All right, Jake, for anybody that doesn't know you, do you mind introducing yourself to the listeners?
Sure. So my name is Jacob Harden. I am a chiropractor out of Orlando, Florida. I run Orlando Sports Rehab down here, and I teach continuing education, kind of centered around that topic, evidence-based rehab. And been doing kind of the social media thing like these guys for a while, and that's how I think most people know me. But lately, I've gotten to be the patient, so with dealing with some persistent sciatica.
Yeah, and that's why we brought you on because we wanted to hear about your perspective from having it for a longer time frame as well as having it as a clinician. So maybe just start from the beginning. What happened? How long have you been dealing with it?
Yeah, so it's a bit of a it's a bit of a hazy start because like there's things I know and then there's things I can only really speculate on. So starting with what I know, it's actually 6 months to the day that we're recording this. It was like April 22nd. Um I I was feeling kind of beat up in my training and I was on a deload week and it was kind of like end of the week and I um had been dealing with this like nagging right hip pain, and it would only come on whenever I would hip hinge. And I knew that it was kind of like neural based, just because like a slump test really set it off. And I would get on. I have a seated leg extension and hamstring curl machine here in my gym, and like I would always feel it right there. Trying to get on that first set, it would suck, and then have to like warm it up. So I had dealt with that for about a month, and I was kind of fed up with it. So I decided in that workout in April to do some kind of just like neural mobilizations, and did a few sets of that. Woke up the next day, and my right hip was just like on fire and I couldn't extend my leg walking. I couldn't extend my knee walking. Um, and that's kind of the way it was. It was just like this really just intense pain in the leg right there that next day. Um, I assumed, okay, I probably pissed off the nerve, and like my thought process was, all right, it's gonna be transient. It's just gonna settle itself down. I just back off from aggravating it. It didn't, and it actually kind of progressively got worse over time. And kind of 6 months later, still dealing with it.
And have you had any history of, sciatica like symptoms or even just this neural, mechanosensitivity in the past?
Not really. Yeah. So that's is really new to me. I've dealt with a lot of back pain over the years. And I actually dealt with back pain for most of 2020. Like uh, early morning pain, getting out of bed could kind of subside by about 10 a.m. or so as I would get up and start moving around more, and I wouldn't really feel it anymore after that. But I dealt with that for most of 2020, and but never really anything neural. Never had leg pain ever in my life. Um, outside of maybe like a pins and needles here and there, but nothing I would consider sciatica, and definitely not anything I would say like, oh, that's radicular pain for sure.
I always think about like, did anything change in life or training that you noticed that might have contributed to your symptoms and to this, kind of flare up, I guess?
Yeah. Well, yeah. So this is where we kind of get into like I can only speculate because I just don't know anything beyond April. But I'm speculating. I think that there was an incident in February where I was doing a squat, and on my last rep of the squat, I was coming up, and like the best way I can describe it is it felt like my back flexed on the way up, but my torso position didn't change. Like it was literally felt like I was doing like a pelvic tilt on the way up. And I was like, that is weird. I have never felt that before in my life. Um, and I had some like I didn't feel right after that. Like I went over and I jumped on the hamstring. I kind of like it was the last set of squats. So I went and I had hamstring curls after that. I really couldn't put out any force on the hamstring curl, whether that was guarding or what happening there. And then I had some like burning back pain that day. that afternoon because I remember I took my son out to the park and I was just like laying down on the slide because it was just the only thing that was comfortable. It was like my back was just kind of burning. But then I put him down for a nap. And I was like laying down for about an hour or so, got up, and I was good the rest of the day. And I was back to training normally within a week and a half, no issue whatsoever. Um, and I don't know. I mean, it's like and that happened kind of randomly. It was I wasn't like going crazy with my training loads or anything. I've been progressing, on like a linear periodization sort of thing, just kind of wave loading. So it's like I've been doing that for a while. Um, it had, maybe I don't know. But anyway, from that was the point where I kind of started to feel that hip pain was after that too. So um kind of jumping ahead, I've had an MRI, and I have an L5 extrusion there, which correlate, and it's all right sided, which correlates right there with my symptoms at the being all S1 nerve root related. So I wonder if that feeling was maybe that feeling of maybe that disc herniating. Whether that's correlated to the back pain I felt all of the year prior, I don't know. You get much more speculative beyond there. As I went into that kind of deload, I was starting to feel a little more beat up, so like fatigue was definitely getting higher over that time frame. And whether that maybe my body was just starting to be like, all right, like this thing happened 4 weeks ago. You've kept training, you've kept pushing, and now like you're feeling beat up enough to take a rest or something. It's like the body's probably in a bit of a higher stress state now. And then doing the nerve work directly and kind of just directly kind of poking at it seemed to be that thing that you threw that factor into the mix, and all of a sudden here we are, we're actually kind of in this pain state now.
That's interesting, right? Because we always try to determine, should we like kind of poke the bear or back off, and it seems like, well, maybe in that instance wasn't the most appropriate. Once again, we're speculating. We're not 100%
Yeah.
sure if that was a thing. What has your training been looking like? Like, I guess before that all happened, so in February and April, it sounds like maybe you're doing like a powerlifting, bodybuilding type combo, or just,
Pretty
yeah,
much.
yeah,
Yeah. Yeah. But powerlifting. I don't want to say powerlifting because it was like linear periodization, wave loading. So it'd be like week one, I would do sets of 12. Next week, I do tens. Next week, I do 8. Next week, I do sixes. And then I would, gradually increase the weight each week as the reps dropped. Finish that wave, restart back over slightly higher. And I ran that for 4 months prior to all this. Wasn't anything crazy. And I was probably RPE 8-ish on most of those final sets, or most sets there. And coupled that with some accessory isolation work that wasn't overly stressful, doing cardio a couple days a week, rower and assault bike on top of that. And that, I mean, that was about it. I had done some running earlier, but like in that summer before, but like I wasn't running or anything at the time being. But yeah, that was the majority of what I was doing: squatting, deadlifting, pressing, all that kind of stuff.
gotcha. And so going back to April 22nd, you know, you had this, kind of flare up, and you decided just to see how things would go. And, maybe they didn't progress the way that you expected them to or wanted them to. At what point did you decide, okay, now I actually, have to address this doing something different, or like I have to go and, get this MRI. So how did that play out?
So around week 3 weeks into it, I woke up one day and I felt like I had strained my right calf. And I didn't think too much of it at the moment because like, okay, maybe this is just a symptom of this ongoing nerve pain. I've never had this before, so maybe this happens. But like it felt strained. Like it felt like I couldn't extend it. Like I didn't have a lot of dorsiflexion. And then that pain settled to where like it wasn't hurting to like walk and push off of that foot anymore. Um, but all my strength was gone. I had no strength in my right calf. Couldn't do a single leg heel rise at all. Like I've never had something where I was like, I am staring at my foot, being like, move, dang it. And it will not move. Like I'm trying everything I can, it won't move. And that was the point I was like, oh crap. Like we have a neurological deficit here. And I'd had some, I was noticing some like numbness in my little toe on the outer side there on that right side. Mostly when I would like put a sock on, I would just like, I'd have a sock on, I could feel it. It felt like I would had like a lidocaine injection into my toe. And so that was there. And so I was like, okay, let's take a look at this. So I had my wife, Monica, who's a chiro as well. She tested it and I had no Achilles reflex. I actually don't think I have an Achilles reflex now either. I don't think that's actually come back. The strength has come back. But that was the point that was like, all right, let's, an MRI is probably going to be useful here just because I'm due to the neurological deficit, if this persists, I'm probably going to want to at least consult with a neuro. And they're not going to see me unless I have the MRI. So to get that ball rolling, I decided to just have the MRI ahead of time. And, you know, it didn't necessarily change how I managed it per se. But it changed kind of the trajectory of what my expectations were going to be for it.
Yeah, and we'll talk about how you've been managing it here in a minute. But you mentioned you had this MRI. You have this extrusion. Obviously, you have this weakness and this change in sensation. Did you consider, surgery at any point during this process? And have you had any other, interventions from, a doctor's standpoint?
Yeah. Yeah. I mean, I was considering surgery for sure. I mean, I went into the neurosurgeon's office, at least considering it. And I mean, I feel like part of my progress across the time frame, part of it was like, how many times did I think about calling the surgeon's office this week? And like, the less I've been considering that, the more progress I've seen. Because I still have their card sitting on my fridge. But yeah, I went to the neuro and I talked to him, and I wasn't too concerned about the pain. The pain was intense. Like it was intense at the time, but like it's still early into it. So I was like coping with it well. I was more concerned about the lack of strength. I was like, I don't want any long-term problems here functionally with strength because like I was limping when I would walk, to the point that like, I felt like I was giving myself tendonitis in my Achilles because every time I would step, I was like, I would dip into that ankle. I was just like pogo hopping for a mile and a half as I was walking because I just kept like rapidly stretching my Achilles. And so I was more concerned about that. And the neuro basically told me, probably what we know, which is the surgery will probably help the pain. And long-term, and he was very upfront. It's like, hey, long-term outcomes, surgery versus managing it conservatively. Everyone kind of seems to be in the same spot, but with, we might be able to reduce symptoms a little bit faster with the surgical route. But he said, but if you're more concerned about the strength, I can't make you any promises there. And, but he was like, I can schedule you in 3 weeks if you want to be here and do this. It just so happened that right maybe 2-3 days before I had that appointment, I got some glimmers that my calf strength was coming back. Like it was just like I would do this test where I would basically just toe walk across my house. And it was like, not that I could walk on my toes, but it was like how rapidly would I fall would be my measure of progress at that point. And I would get like half a step all of a sudden where I was like, oh, I didn't fall immediately. So I was like, all right, I'm getting maybe, right? Maybe something's going to come back here. Um, and my rule across this whole thing has been, as long as you're seeing progress, you keep going, right? Because as long as you're seeing progress, there's nothing to say you won't keep seeing progress. Don't step things up until you're stagnating. Um, and so I held off and didn't schedule surgery at that point. But I've thought about it I thought about it a number of times. The calf strength did come back fully. The numbness was second. That settled eventually. That was never bothersome to me at all. Um, I mean, I told my wife that if the numbness stayed forever, I wouldn't care. But and then the reflex still is gone. But the sharp shooting pains settled eventually, just with time. But I was left with this like really deep aching in my right hip. And it felt that was worse to me than anything, because it was like it would engulf my entire leg and just be it was miserable. And I was lucky in that I found that ibuprofen helped control that. So that was nice to I could kind of like function with ibuprofen with that. And my thought was, okay, well, because ibuprofen's probably helping me, if this isn't placebo, then there's probably an inflammatory component going on. So I considered getting an epidural injection. So I've had 2 epidural injections since then. The first one was 5 weeks ago, and that took the pain from, I could be on like prior to injection, I could be on my feet for maybe 20 minutes before I had to go lay down. Yeah. And this was at 5 months, 4.5, 5 months in. I could only be on my feet for 20 minutes. Um, Otherwise, it was like better with ibuprofen and that kind of stuff. But without it, that was my limit. So post injection, I could be on my feet and I would feel it, but it wouldn't spread and engulf my whole leg. So that was really nice. That basically like got me to the point I could function without daily NSAIDs, which was a concern for me, that I didn't want to be on daily NSAIDs. So then I had the second one a week ago ish, maybe 2 weeks ago. I don't know, somewhere in there, probably a week ago. And less results from that, but also like my pain's been more controlled since then. So there was less to get. But it's helped as well. I had a little bit of an additive effect. But I mean, that's been my only medical management so far, was the injections, the NSAIDs, and then the surgical at least consult.
Do you have a third injection scheduled, or are you going to kind of play by ear, see how things go, and
I
determine it
don't.
from there?
Yeah, I have one scheduled, but I think I'm going to cancel the appointment. And it's controlled enough now that I don't know what an extra one's going to do for me. They're also like, the pain management clinic has been like really pushing me to do injections at 2 levels and not one. And like, I just don't see the benefit of going up a level and doing an injection higher, other than they get paid more, in all honesty. And like, I'm paying out of pocket because I have a very high deductible on my insurance. So I'm like, it's controlled now. And you only get 3 within like a year's time frame. So I'm like, I I would rather be able to go back if these wear off and get that third injection to kind of pull me back to a manageable level if, you know, knock on wood, I end up needing that.
It's interesting to hear how this kind of played out for you because, one, obviously, I don't want to group all surgeons together, but it seems like you had a somewhat conservative surgeon in the sense that he let you know those realistic expectations that, yeah, the surgery is probably going to help with the pain, but he couldn't guarantee that it was going to change, that neurological function. And then also you, from a clinician perspective, knowing that you can monitor your strength and your sensation and your reflexes and see how that's progressing to help you determine whether or not maybe you should lean more toward or away from surgery. And, the patients might either one, see a surgeon who is, a little bit less conservative or not have that knowledge. Do you think that's been, helpful for you? Just, being a clinician and knowing what you know regarding the research and kind of the time frame for some of these kinds of conditions?
100%. Like 100%. Yeah. Um, like I was thankful to my surgeon for telling, for saying what he said there. Like, basically reinforcing what I knew going in on that part. But he also pulled out his disc model and was like, it's basically like your nerve is in a vice and it's being squeezed. And he's like, and I mentioned how the pain, the pain seems like it's been getting a little better. He's like, yeah, the pain will get better as the nerve's dying. I was like, Jesus Christ, man. Like, what do you like? Don't, I can't imagine what one of my patients would think, that with that. But, and what else has helped me is like, from like my perspective as being the clinician as well is I really noticed like the influence of just like family and friends around me too, and how like they changed over the weeks that I was dealing with it. Because when I would, when it first started, like no one really was too bothered by it. Um, and but then it's like 2 weeks in, and I'm still dealing with it. And my family's, my parents, they're kind of like, you think you should go see somebody for that now? Like you think it's time to go see somebody? And a couple more weeks, and it's just the concern is just ramping up from because they care about me, and that's their way of showing that, and naturally, right? And and they're like, I think you should go get an MRI, and I'm like, or I think you should go see a doctor. I'm like, Mom, I am the doctor for this. And the only person who didn't throw a recommendation at me was my wife, who is the other doctor in the family, which is funny. So I think about patients, and they're probably going through the same thing. Like they have loved ones around them that are having those same concern levels and are throwing those recommendations at them about what they think they should do. And if they don't have this background, they don't have their nose in the books, to kind of understand maybe what the steps are in terms of how this should go and how to manage it. Um, and so, yeah, I think I was just, it made me less, or it made me more resistant to outside influence, and just be able to kind of stay the course of what I felt was best.
Yeah, I don't think people appreciate how much those family and social dynamics play into this experience of pain. Like you said, like, yeah, you have a wife, you have a son, you have your parents. It's interesting. It's also interesting hearing about the description that you said your surgeon used regarding like that nerve being stuck in a vice. Because I've worked with somebody who had a fusion, right? And then the fusion ended up failing and she needed another surgery. But at some point, there was like a discussion of shrapnel or like metal touching her nerve. And from that point forward, after the second surgery, anytime she felt pain, she, in her mind, she was visualizing like shrapnel or pieces of metal, like just stabbing the nerve. And no matter how much we discussed it and tried to, let her know and reassure that that wasn't the case, it was very hard for her to let go. She had been dealing with this for years and years and years, because no one else had told her otherwise or listened long enough to hear that that's what she was imagining in her back. So once again, it's nice that you're the clinician to know, like, okay, yeah, I know that there's probably some swelling and maybe there's some compression, but it's probably not a vice. And
Ice is a strong image.
yeah,
you know
yeah,
Ice is a strong image, yeah. um I think in those cases it's actually good to kind of root your explanations in biology a little bit, and not, because like it is a biological phenomenon, right? So like if I was to explain this to someone else, I would, and I've explained it to family members, and I've talked about it as, this nerve isn't just sitting in a hole in between the bones. Like there's that hole, it's cushioned with fat and stuff. So think of it like the nerve going through a sponge, and something is kind of coming in and putting some pressure on that sponge. Everything in that area is kind of compressing, and there is a little compression there, but it's not like it's, pinning this thing with a chokehold up against the bone. Um, and so like I think that having some image of, okay, what is going on in the area as an alternative is useful in that case. And that's how I've kind of gone about explaining it to other people as I've gone through it.
Yeah, and we had Tom Jessen on, who's kind of like become the,
The guy, I read
the
his book.
sciatica, yeah, the
Yeah.
sciatica guy. And we talked about that too. Like, it's okay to use those explanations, as long as you're following it up, because those can be helpful, and it helps the person understand, what is actually happening. Just being mindful with that word choice. So now, going from what you've been doing, whether it's what you're reading, or like in terms of actual interventions, like, are you icing, heating, walking, doing nerve mobilizations? Like, what have you been doing to help you manage your symptoms?
A lot and not a lot, I guess, at the same time, is though, because there's a lot of things I've done, but like there's few things that have been structured. Um, so the start with kind of the what I consider is like just kind of creating a positive environment for change here. Um, I started by making a big list of everything that was bothering me in terms of activities and movements. So, like, I have a Excel spreadsheet, and it's like standing up from the couch, rolling over in bed, making breakfast, squat, lunge, hip hinge, and I could so that I would have this big like objective list of things I could start to check off as am I getting better. But that also acted as it acted as a progress marker and also kind of a prescription for me. So the biggest thing, was just identifying what activities and positions were really provocative to me. Don't poke the bear too much, so to speak. Um, and modifying those, managing those, figuring out what I can do. And maybe what I should hold off on, because like I'm the person who will go and aggravate things because I want to go and move around and like that's just me. Um so I have to put the reins on myself a little bit. Um I walk every day. It's just normal routine was and just tried to keep up with that. That wasn't anything that was like big change, but I did cut down the distance that I would walk early, just because like my leg would start to get a little more achy as the distance kind of went up. So I started about a mile, or even 3/4 of a mile at first, and kind of built that up to about a mile and a quarter over a few months even of walking. And now I can kind of go out and do whatever I want to do with that. I've kind of expanded that back out to my normal 2 mile walks or so. And then, so those are just like little daily things that have been useful. I couldn't sit. So like I did not work here at the desk. I tried to go and like work on my bed as much as possible or on my couch, because laying down felt best for me. But like if I had a patient and I needed to be in front of the camera, I came and I sat in the chair, or I have a sit to stand desk, so I would try and stand up if depending on just what the day was, it felt better. Um, and I think that helped keep not like skyrocket my symptoms every day. It kind of kept them at a even keel level. At least I'd like to believe so. And then something and then like little things is like I would just like try and do some like cat cow on my bed in front of the mirror to see how my spine, how much spine movement do I have here. Spoiler alert, not much. And I would just kind of like move around, not structured at all, not for reps, not even for time, just like go by feel and just try and move my back a little bit here and there, rock through my hips a little bit. um, so all that's been kind of very unstructured and just stuff that I've just naturally explored with, so to speak. Uh, then in terms of what I've done structured was attacking more specific movements that were important to me, but that I found myself limited in. And that would be the first one I did was like squatting. That was a big one that I could not do whatsoever. Um, and then recently been doing some like split squatting, lunge style stuff, because that was bothersome. Basically anything where I load my right hip is not so fun. Um, but in terms of like timeline, I basically did no lower body work for 6 weeks uh, because it just hurt too bad. Like I would try and just basically be punched in the face and say, no, no, that you're not there yet. Um, so I was upper body only in all of my weight training for about 6 weeks. Then I got to the point that I could elevate my heels up on like a big 45-pound bumper plate and I could squat down. So I put on the BFR straps around the quads and was doing some BFR squats, and I would do them 2-3 times a week, depending on how sore I got. Um, and I would that was basically my leg training for a while. There was a little bit there where I was like fastening a dumbbell to my shoe with a mini band and trying to do hamstring curls because I couldn't sit in the seated hamstring curl machine, and I couldn't do a 45-degree back extension. I can't do a hip hinge. So it's like just trying to makeshift ways with what I could do there. And then lots of calf raises to try and get that calf back. As that's kind of settled, I was able to do a little bit more. I got myself under a barbell, just empty bar. I was squatting to like maybe a high box for a little bit, ramped up load for a little bit, then tried to then reduce load back down and went down to kind of a low box where I've been pretty much since, and just kind of gradually built up on that. Then, like I said, kind of split squatting, doing that kind of stuff now. And recently have been trying to work on some like block pulls and more hinge style stuff, which is painstakingly slow to come back. Even though my pain's fairly under control, I have like no extensibility in the nerve still. So doing that, and trying to get that my knee to extend essentially again from trying to get some extensibility back in that nerve. That's been my management of it so far. So like I said, kind of a lot, but also like very just a few little things here and there that have been like targeted and structured.
And you're a clinician, and obviously your wife Monica's a clinician. At any point, have you considered consulting another chiro or physical therapist or clinician in terms of like helping you with that structure?
Um, no, no, I haven't. I've I felt like I've had it under control. In all honesty, I had so like I reached out to early on just to get some opinions from like whenever I was considering surgery. I reached out to Aaron Kubel and talked to him, and he kind of helped me get my head in the right place. Whenever I was actually the day I saw the surgeon, I called and we talked for a little bit and kind of had a conversation there about what plans should be, and we kind of decided to basically keep seeing, if you keep seeing progress in the 3 weeks, you could always schedule the surgery and then delay it or something like that. So we kind of talked about that. I talked to Teddy Wilsey, what maybe a week later or so, and kind of got his opinions on injections, because I didn't have a ton of experience referring people for injections, and he had more experience with that, and so he kind of gave me some insight there. But other than that, it's just been kind of me managing and handling it. And Monica's kind of been my point of referral too. She went and did a formal assessment on me so that we could send referrals around, so my insurance would take everything. But for the most part, I felt like I've been pretty much in control, and I felt like I can monitor my own symptoms and how I'm feeling so that I can make the decisions that I need to make in terms of where I should be going next.
Yeah, I'd probably be in the same boat. Like it's nice to have this, network of friends who happen to be clinicians. My wife Nicole is also a physical therapist. So if we ever have any little aches and pains, we might, talk it over. So now, what are your expectations moving forward? It's been 6 months. Like, do you have certain expectations in your mind? And along with that, what would be like what would be a successful outcome for you? Meaning, like, oh, I'm not necessarily pain free, but I can deadlift and squat and do my day to day activities.
Yeah. In terms of just day to day getting around pain levels, if it stayed exactly like it is right now, I'd be okay with it. Like I can feel it in my right glute sitting here right now. But like being engaged here on the call, it's not in the forefront of my mind versus like pre-injection, the pain would just ramp up so much I could not disengage from it. And that was like I wouldn't have been able to go on with that. I would call the surgeon and say, all right, we got to step up care here. And that's kind of been my thing is like, I just want to get to a point that I can distract myself naturally from it and disengage. And I'm kind of there. Um, Functionally, I'm not there though, where I want to be. So like, I would like to, like, I want to be I want to be able to hinge. I like and be able to bend over. I would like to be able to touch my toes again. I can't. I still have very, very limited flexion that way. My knee just kind of reflexively bends it like outside of my control, even if I try and hinge over. Um, so I'd like to be able to see that. And I also don't handle impact very well. So I can't run. And I would like to be able to run. And I'd like to be able to, do a box jump or something, and and it just so happened like as I'm going through all this, I have a patient who has who has a patellar dislocation, and we get to the point where it's time for him to start doing plyos, and I'm like, oh great, you know. So being kind of in that sport side of things, like I need to be able to do those things, and so I'd like to be able to do that. That would be a success for me. Is like if the pain stayed where it is, I'm okay, but I need to see my function kind of expand a little bit more, to be at, at least get to the point where I can start to try and maybe habituate and work into it. Because where I'm at right now, I feel like I don't have a very good even starting point into jumping into some of those things. Um, so and that would probably be the only thing now outside of the pain, like really, the injections wearing off and the pain just ramping right back up on me, that would make me consider surgery. If I still can't, hinge, 6 months, 6 more months later, I might get another MRI and see if, am I in that 40% that the disc just didn't regress? And maybe I would be better removing some of that crowding, and then have that conversation down the road.
Have you had any setbacks during that time? Because obviously you're feeling better in terms of the pain now, but have you had any, ups and downs?
A lot. It's This has been the most variable, experience I've had. Yeah, I mean, I think you made the one graphic like what your expectation is, in rehab, but it's like all over the place, right? And that's really what this has felt like over the months. Um, Whereas, most of I've dealt with a number of injuries, and most of them have been fairly linear. They just natural history, they get better, and every day is a little bit better. And this one has just been it's such a difference because I saw a lot of progress up front, like as you would expect to, like pain's high, it's gonna regress and you're gonna have more, relief to find. But as the months have gone on, progress is harder to come by and change is harder to come by. So um there are those more sensitive days. Today was a more sensitive day where like I was in the gym today, I was trying to do some block pulls and I was just getting frustrated because I'm like, I was better last week, and like I was like finding myself there. There was but in terms of like downs, like the transition from month 3 to month 4 was the hardest. Like that was just the hardest point for me. Um, which I think is something that actually I think it's fairly common. Like that 3-month mark it's a tough time point because it's this for me. It was this point of like it's where mentally it was the hardest for me because the pain was in that it's just it was that constant ache, that constant kind of engulfing my leg kind of ache. It was waking me up at night whenever I would try and roll over in bed and stuff like that. So like that's impacting me there. But the biggest thing was I think it was that was the point that I was like realizing, oh, okay, I was still holding out hope that this thing was just gonna fade away. And I'm having to kind of really come to that realization that this is going to be a longer time frame thing that I'm gonna have to deal with and manage, and I'm gonna have to change my thought process around like, you got to figure out how to live with this thing right now, and so like that was a tough little time period for me that I had to kind of to get through. But then, as I kind of got through it and kind of got my headspace back where it needed to be, it became easier. So um there's been mental ups and downs, there's been physical ups and downs. Yeah, much more than I'm used to.
Building off of that, like as a clinician and other aspects of your life, like has this affected your identity? And if it has, like how has it?
Yeah, I think about that a lot, about how this I think that's part of that's just part of like why it's so distressing. Um and it's part of like the early on. That's why I say I coped better early than I did later. Which is why that month 3 area was so hard for me, because like early on, like it was uncomfortable because it was uncomfortable. Like it was just 10 out of 10, 8 out of 10 pain all the time. And it sucked. It took my breath away. It made me want to scream. But like as at month 3, it's not the pain is not as intense as it was before, but it made me want to just go lay in bed. Like I didn't want to deal with it. I could like that was horrible. Um, and that was where I think there's just a lot more frustration there around like my mental representation of myself is someone who's active and who lifts weights, and like that's a big part of my personal identity is this is what I can do. I'm a dad, I can run and chase my kid, I can pick him up. I don't like that if I'm laying on the ground and he walks over behind my back where I can't see him, all of a sudden like I'm getting like freaked out because I'm like, is he about to jump on my back and send a jolt down my leg? And so um there was definitely that like internal struggle of the who where I am right now just does not match this internal picture of who I am and who I know myself to be. um and part of what kind of pulled me out of some of that also though was just like really coming to some form of acceptance that you know this is your state right now. Like this is a piece of it, and it doesn't mean that you're accepting that doesn't mean that like you don't continue working towards going back to where you want it to be, but like you have to accept this is just where it's at right now, and you're going to have to be okay with that because it's not going to change tomorrow. um so yeah, there's been some identity there's been that kind of identity issue there of you kind of just see yourself as like, okay, I'm a person with sciatica, or I am injured, like that is becomes a little bit of a piece of you of um you just don't feel like yourself. You don't move like you're used to, you don't feel like you're used to, you don't, and like that. So yeah, it's been a piece of it for sure.
Yeah, I do think that that's often one of the most challenging things as a patient is struggling with their identity and having some of that acceptance of I'm a runner, I'm a power lifter, and maybe temporarily they can't be, or they can't be to the same level. They can't be a marathon runner. They can't be, uh, you know, um, a medalist in powerlifting. But that doesn't necessarily mean that it's permanent. So I guess putting all this stuff together, what have you learned the most from this experience, just for yourself, and obviously the patients that you work with?
For myself, I've I've learned some grit. That's for sure. I've learned that I can take more than I thought I could. It going through going through it. If you had told me at week 2, week 3, even a month in that I'd be sitting here 6 months later, like, and you would tell me like you're gonna deal with this for 6 months, like I would have been on the surgeon's table, like straight up, would have been on the surgeon's table. I just would have called him and said, no, I'm not doing that. I'm not dealing with where I was there. Even if you had told me at 3 months, it's going to be 3 more months, because my your mental representation at the time is like, oh, it's like this, 3 more months of this, no way. And so I have kind of learned that like, okay, like you can deal with some stuff here. And it's really having to walk the talk a bit. Like this is what I talk about. Now I got to do it. And so I've kind of shown myself, one that like, okay, I'm not spewing bullshit over here. Like, okay, this stuff works. That's good. Um, to for patients and how I work with people, I think it's made me feel easier about being more realistic with time frames and letting people know that like you might have to deal with this for a while, but let's take it day by day, week by week, and piece by piece. Um, and I think being more open with people about like, we hear, oh, 4 to 6 weeks, 8 to 12 weeks, and how this kind of gets thrown out as a default recommendation almost sometimes, especially with so many like non-specific conditions out there. But some people are gonna take longer, and it's normal. Like that's part of it, and it's I don't consider myself somebody that catastrophizes my pain, and I don't have fear and anxiety around things, and a lot of the risk factors that we might see for persistence and just took a long time, you know. And so I'm okay. I think it's maybe more open to telling people like, hey, I would expect to see some improvement, maybe even a lot of improvement in 4 to 6 weeks. But you might be dealing with some more symptoms. It might take a little bit longer. There might be a recurrence here and there where you might have some periods where your symptoms are gone, they come back. I feel easier making that recommendation to people because then I can throw on the back end of, but you're going to see, but you should see improvement. Like, let's take it day by day. And I can also kind of tell my own story of like, I've been through this. Okay. I'm not speaking from my ivory tower of someone who's only ever had pain for a week at a time, telling you to go deal with this for 6 months now. And the other thing I think that's helped me with patients is just kind of uh, being more open to just checking in with people too as things go along. Because one of the things I found, and maybe one of the things that even surprised me was like that identity issue was, like I said, I'm not somebody who I consider myself a fairly resilient person. I don't catastrophize about my pains and stuff. I wasn't afraid of what was going on by any means, but there were times where I felt depressed just because like I've been dealing with this for so freaking long, and it weighs on you. Just being in pain day in day out, it weighs on you. So that person who filled out your yellow flag questionnaire day one and like scored perfectly, and now they're dealing with pain still 3 months later. Hey, check in on that person because it'll get to anybody, you know, because it's a stressful experience, and dealing with stress, constantly like that. Um, it's tough. So recognize that it's made me recognize that, which is something that I think I knew, but like maybe I didn't know it, or I didn't focus on it enough, and now I do.
Well, Jake, we can't thank you enough for coming on. Like, you just sharing your story, your experience is so helpful for clinicians, who are working with, patients dealing with these symptoms, or who haven't. Maybe they're going to have better expectations when they do. And also, for the patients listening who, maybe are in similar uh, shoes as you right now. So, thanks a lot for coming on. If people want to learn more about you, from you, where should they go?
My Instagram's my big platform. I promise I'll be on there again at some point. I've been gone for like a year, but I promise I'll be back. And I'm on my other platform that I'm on a lot is Twitter. So, Dr. Jacob Harden is my handles. Feel free. Anyone's welcome to reach out there. I'm always in my DMs.
Awesome. We'll make sure to link that. And yeah, thanks for coming on.
Thank you.